Hi, my name is Rick. I have severe hemophilia B, and IDELVION gives me more freedom to do the things I want to do. Most of my life was spent in and out of the hospital. My wife, Leslie, has always been worried about me. She knows the severity of my hemophilia. When I was 12 years old, the doctors told my parents that I probably would not live to the age of 18. There's been a few incidents in my life where it was touch and go for a while. My personal challenges started when I was in school. My biggest fear was not being accepted. I was bullied and picked on a lot. Because of my hemophilia, I was forced to sit on the sidelines and the bleachers and watch as the other children played. And that's when I first felt like I didn't measure up with the other kids. It had an effect on me that I really didn't outgrow to my later years in life. Prophylaxis wasn't offered till I was in my 50s probably. At this point in my life, I was no longer able to walk because of the injuries I sustained over my lifetime. I required braces and would have swelling and microbleeds constantly in my ankles. I could only walk a block or two. I was in such severe pain. I decided pain was not what I wanted to deal with on a daily basis. I started prophylaxis in my late 50s, early 60s with a short-acting factor 3 times a week. And being my age 3 times a week, it becomes harder. And then switched to a longer acting factor, which was fantastic at first, but it lost its efficacy for me after a couple years. And my doctor suggested IDELVION. Since I've been on IDELVION, I've had successful ankle replacement surgery on both ankles and had no complications from surgery at all. I've now been able to walk longer distances than I could ever imagine. IDELVION has maintained its efficacy for me since 2017. I have not had a spontaneous bleed since I've started on IDELVION. That has taken a lot of the pain out of my life, a lot of the stress of worrying about bleeding, and that has allowed me to explore my body more through Tai Chi. Hemophilia is in the background of my mind. I really don't think about it as much as I used to. IDELVION allows me to measure my factor IX level and trough level. With a high trough level, which is the level of my factor right before I infuse again, I'm better protected by being on IDELVION. It's less to worry about every day. I trust IDELVION. I know that it works for me on a daily basis. I can count on it and can just enjoy life, do the things I need to do, and not have to worry so much about, will this cause a bleed? Will that cause a bleed? I would never consider switching to another therapy. IDELVION has kept me spontaneous bleed free for many, many years. That doesn't happen for everybody, but it's happened for me. My grandson has hemophilia B and is on IDELVION. He's been on since he was 6 months old. He's doing very well. I have 15 grandchildren. I'm able to play with them and not just to have to sit on a bench and watch. I'm able to enjoy life with them. If you're not happy with the product you're on, talk to your doctor about IDELVION. My doctor shared common side effects including dizziness and headache, but these are not all the side effects. Be sure to tell your healthcare provider if you experience any side effects. My treatment has made my hemophilia very manageable. I feel more confident in the ability to live my life, and I would like to see everybody like that. I trust IDELVION because IDELVION helps give me the bleed protection I need for doing the things that I love.
Important safety information. IDELVION, Coagulation Factor IX Recombinant Albumin Fusion Protein rFIX-FP, is used to control and prevent bleeding episodes in children and adults with hemophilia B. Your doctor might also give you IDELVION before surgical procedures. IDELVION can reduce the number of bleeding episodes when used regularly as prophylaxis. IDELVION is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject IDELVION without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use IDELVION if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor IX product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor IX, which could stop IDELVION from working properly. You might need to be tested for inhibitors from time to time. IDELVION might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. The most common side effects of IDELVION are headache and dizziness. These are not the only side effects possible. Tell your healthcare provider about any side effect that you experience and contact provider immediately if bleeding does not stop after taking IDELVION. Please see full prescribing information for IDELVION, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.